Hi, Dr. Salinger here. Today I want to talk about herniated disc and what we do to treat that condition. People have herniated disc in their neck, in their back, in their lower back. And the spine model here shows these are bones in the back called vertebra, and these are the discs that kind of act as like a shock absorber between each one of these vertebra. We also have nerves in the spine, and sometimes that disc can become damaged. We can have a herniated disc. The material inside the disc leaks out, putting pressure on the nerve. Sometimes that can put pressure on the nerve, or it can put pressure on the spinal cord, which would be up a little higher. Another model I have here that really is a great way to see the disc is from a bird's eye view. This is the disc right here. This is a normal disc. Inside the disc is something called the nucleus pulposus, which is a jelly-like substance, and around it is a tough fiber cartilage material called the annual fibers. When the annual fibers tear, the jelly in the middle of the disc can leak out. Usually it goes to the sides or the back of the disc, which would be here. If it does go, it can lead to compression of the nerve right here, or it can lead to pressure on the spinal cord, which would be right over there. What we do, one therapy we do for herniated disc or bulging disc is something called spinal decompression therapy. Now, what the spinal decompression therapy does is it helps to create a negative pressure inside the disc, allowing nutrients to come into the disc and waste products to come out of the disc. The disc doesn't have a lot of blood supply, so the disc gets most of its nutrients through diffusion. When we have a patient on the spinal decompression table, it helps the disc to heal. The spinal decompression therapy is something that we do. There's a series of treatments that we do. It is something that's conservative. It doesn't have, you don't have to go into surgery. It's a good conservative treatment that somebody can try before they have to get surgery. So we evaluate patients, we see if they're the right candidate for this procedure, and if so, then we could start with that type of therapy. If you know anyone or you suffer with a herniated disc and you would like more information, please contact our office at 561-434-9949. Thanks a lot and have a great day.